According to the American Language and Hearing Association, between 6 million and 8 million people suffer from a speech disorder. Many of these speech impairments go unnoticed and don't affect the person on a long-time basis, but some of them do. Some of them have to suffer through their life with a speech disorder and have to get made fun of and not want to go out in public and be ashamed of it. There's a lot of treatments and a lot of support and therapy that are given for speech disorders. It's no laughing cause. In this paper, I want to go over the risk factors, the symptoms, and the treatment. I've been given the experience to be able to work with a girl who has a speech disorder and who had suffered a very bad brain traumatic, and she works every day to be able to speak and talk and to interact with her peers. It is no laughing matter, and they have to live every day in shame. One of the speech impairments that I want to go over is a cleft palate. A cleft palate is it's a little nudge that a person's born with, and their lip can be split a little bit or can be split completely. There's a lot of risk factors that come with a cleft palate. They have trouble gaining weight, eating, and a lot of the times they can't even speak right. A lot of people can't understand when they're talking. Cleft palates are more opted in men than female. It is also researched that many cleft palates come from a history within the family. A cleft palate it's a very awful thing that you have to suffer with. It can be on one side of your mouth or it can be on both of the sides. There's many symptoms, and many children have to suffer all day and every day, and it's a shame in most countries. They have to feel like they're not the same, and they really have to work for life, and it's nothing that someone wants to live with. Fortunately, there's a lot of options for people that have cleft palates. The surgery is the best one. Usually surgery is performed between babies that are 9 weeks and 6 months old. Many countries don't have the medical supplies like we do in the United States, so many countries don't give the opportunity to children that are born with cleft palates. Cleft palates are a terrible disorder for many people in foreign countries. 1 out of 700 newborn babies are born with cleft palates. There's a 5% chance that your baby could be born with a cleft palate. If another child is born with a cleft palate, you may have another child that is. It's very hereditary. Now that we have learned about the risk factors, the treatments, and the symptoms, I'd like to talk to you about apraxia. Apraxia is a disorder that people have to live with every single day of their life. It's usually caused by a stroke. And sometimes people are born with it, but not most likely. Apraxia is something that you have to suffer with every day. It's hard to even say simple words like, "How are you?" or talk with people. It's a very hard disorder to live with. Apraxia is caused in the brain. Your brain can't send the signals, and they're being blocked. So when people ask you to do something, it's hard to do what they're telling you to do. Or what you're thinking may not be what you say. Apraxia is something that you have to live with every day, and it frustrates people, and they have a really hard time doing what people tell them, and it's really hard to do normal daily tasks like me and you can do. There's a lot of treatment for apraxia, but it's also very difficult. A lot of apraxia patients have to go through hours and hours of therapy with an occupational therapist or a speech pathologist. Many of them have a very hard time because they can't do what they're wanting to do. They can't say what they're wanting to say. Their brain is trying to send signals that are they're being blocked, so they can't do it. It takes a lot of repetition. Now that we've talked about apraxia, I'd like to talk to you about the most common speech disorder, and I'm sure everyone knows, it's stuttering. There's a 75% chance that your child is going to have a stuttering impairment when they're little, but most kids grow out of it. Everyone knows a kid that has a problem with stuttering, like having problems saying a word like, where are we going? It's very hard on the child, and it makes them feel very ashamed. The frequency of speech is also affected by stuttering. A lot of them can talk and keep saying, It's not life-threatening, but it is very embarrassing. I had a stuttering problem when I was younger, and I used to be so ashamed, and I would hate talking to people because I was so scared that I was going to stutter and they'd make fun of me. There are many treatments for stuttering. A lot of children go through therapy and speak with a speech pathologist or occupational therapist so they know how to talk and they know how to pronounce right. Many stuttering children grow out of. There's not a lot of adults that suffer from stuttering, but there's some. It's a very embarrassing thing. Speech pathologists say that stuttering is the most common speech impairment. It's very embarrassing, but it's nothing that is making fun of. There's a lot of symptoms. If your child is having a hard time speaking, or is very embarrassed or very quiet towards others, you might want to see if he has a stuttering problem. Now that we have discussed all three of my speech impairments, I'd like to inform everyone that it's not a joking matter, and everyone needs to take the time to realize how much that person has to live with grief and how they're so ashamed of themselves. It's not a joking matter, but there's always help for people that have speech disorders. You just have to be patient with people, and they have to get a lot of time and therapy to help. I hope that my research has helped you learn about speech disorders and knowing that it's not a joking matter.